Hello, my name is Corinne and I work for Alberta Health Services. Too many lives have been lost as a result of the opioid crisis. We know that naloxone can be effective in temporarily reducing the effects of an opioid overdose. Today, I am going to show you how to deal with a suspected overdose and how to administer naloxone. If you are using illegal or prescription opioids, or you're with somebody who is, these are the signs and symptoms of an opioid overdose you need to watch out for. You can't wake the person up. Their breathing is slow or they're not breathing at all. Their nails or lips are blue. The person is choking or they're throwing up. They're making gurgling sounds or their skin is cold and clammy. If you see these symptoms, don't leave things to chance. Call 911 immediately and follow the directions of the operator. Canada's new Good Samaritan law can protect you. The Good Samaritan Drug Overdose Act provides some legal protection for people who experience or witness an overdose and call 911 for help. If the person is not breathing, open your overdose response kit. Each naloxone kit contains 3 vials of naloxone, 3 safety syringes with needles, 3 alcohol swabs, 1 pair of gloves, 1-way rescue breathing barrier mask, and an information pamphlet. The first thing you're going to want to do is put on your gloves. Next, if the person is not breathing, remove the 1-way barrier mask from the kit, insert the larger end into the patient's mouth. From there, do a head tilt, chin lift, plug the nose, and give 1 breath every 5 seconds for 2 minutes. Make sure you see the chest rise and fall with each breath. If nothing changes and they are still unresponsive and not adequately breathing, inject naloxone while you wait for first responders to arrive. Remove a vial of naloxone from the kit. With your thumb, pop off the lid. Open one of the alcohol swabs and thoroughly clean the top of the vial. Place the vial on a flat surface and remove one of the syringes from the kit. Remove the cap from the syringe. Holding the vial on a flat surface, insert just the tip into the vial. Keeping the vial upside down, slowly pull back the plunger to fill the syringe with the entire contents of the vial. Check for air bubbles in the syringe. If there are air bubbles, gently tap the syringe with your fingers until the air bubbles rise to the top of the syringe. Then, slowly push the plunger up to force the air bubbles out of the syringe without removing the needle from the bottle. If there are any bubbles remaining, that is okay. The naloxone should be given into the middle of the thigh. Ideally, remove as much clothing as possible. In this case, the injection will be given through clothing. Hold the needle like a dart and insert the entire length into the thigh at 90 degrees. Slowly and steadily push the plunger until the entire contents of the syringe has been injected into the muscle. You will hear a click when this happens, indicating the safety mechanism has been activated and the needle has retracted. Naloxone will typically take between 2 and 5 minutes to start working. Continue rescue breathing for 2 minutes. If there is no change or the individual is still unresponsive, give a second and third dose of naloxone as needed. If they start breathing but are not fully awake, turn them into the recovery position. After the individual is placed in the recovery position, return all pieces of the kit to the case and provide the case to EMS upon their arrival. After the person receives naloxone, they will experience withdrawal symptoms. Offer reassurance and tell them the effects of naloxone will wear off within 30 to 90 minutes. You should encourage them not to use any additional opioids once they've received naloxone. Wait with them until help arrives. Naloxone saves lives. You can obtain a naloxone kit at over 1,400 sites across the province, including most pharmacies. You do not require a prescription and you do not have to show identification or your healthcare card to obtain a naloxone kit. For more information, please visit drugsafe.ca.